But hi, everybody. Welcome. My name is Steph Ains. I'm an organizer with the Right Care Alliance. After the past couple weeks, almost a month now, of talking about this town hall, I'm so happy to see all of you and for this town hall to come to life. So in just a second, I'm going to go over what the plan is for tonight. But before we do that, let's just get a sense of who's here with us tonight. I'm going to ask some questions, and if this applies to you, then please put your hand up in your video or type into chat something like, "That's me." I'm trying to type that. I'm just not able to speak and type at the same time.
Yeah.
All right. So if you are here from Massachusetts, raise your hand, give a shout. All right. People are jumping in. That's great. If you're here from Maryland, give a shout. I'm not hearing. Aha, great. There's a Marylander. If you're here from Washington, D.C. Great. Tennessee. I know our Nashville chapter is represented, so there's quite a few of you from Tennessee tonight. Awesome. If you're here from Florida, give a shout. Great. California. Maybe no Californians tonight. Okay. What other states? I think we have some folks from Pennsylvania. All right, Tracy from LA. And I'm sure that there are people from other states I didn't mention. Virginia, of course, I did the other DMV states. So if you're here from other states, please shout out in chat what state you're coming in from. Who here is a healthcare worker? Minnesota, great. Retired, oh, that still counts. Yeah, I'll let the chats keep coming in. I know there's many of you. Well, we're so glad that you're with us tonight. And anyone who's a patient activist, give a shout. Jonathan, that absolutely counts. This is anybody who's involved in a healthcare worker in any capacity. Awesome, the patients are rolling in. Great. Anybody here, you or a very close immediate loved one have COVID? Have you had it? Not necessarily you have it right now. Well, that's maybe not something that I'll cheer for, but very grateful that you're here. All right, and there's so many other ways to explain who we are, what we do, why we're here. We're going to get into all of that later on throughout the night. So the way that our town hall is going to go is that in just a couple minutes, I'm going to pass it over to David Glenn from the Right Care DC chapter. David is then going to walk through what the state of COVID testing is right now, why tests are in such bad shape, what we know, what we can do about it. Carleen Sabusap is going to add on to that, talk about our barrier-free testing campaign, which we are officially launching tonight. After that, we're going to hear from about 5 storytellers, people who have really struggled or didn't end up at all able to get a COVID test, and they're going to share with us what their experiences have been like. After that, we're going to go into breakout groups. You'll have a chance to think about how do you want to take action on promoting barrier-free testing by writing op-eds, planning a protest, which can be in person or digital, or planning policy. So in the breakout groups, we'll talk about what next steps for all of those activities mean and what they look like. And then we'll come back together. We'll talk about what happened in the breakouts and we'll plan some next steps together. I want to make one disclaimer before we get started, which is that we're going to be sharing a bunch of photos tonight, unless it's very clear otherwise. All of the photos came before COVID. So like this photo up right now, any photo of people who are in person together, those are all in the ancient days of COVID. We are very pro-mask, very social distancing in the RCA. So with that, I'm going to pass it over to David to get us started.
Thanks, Steph. And thanks to all of you for being here tonight. Just want to do a quick introduction to the Right Care Alliance. Many of you know us well, but The Right Care Alliance is a grassroots coalition of clinicians and patient activists working together to make healthcare institutions accountable to their communities and to put patients, not profits, at the heart of healthcare. The Right Care Alliance is an initiative of the Lown Institute, which is a Boston-based foundation which has been active for many years in trying to build a more just and more caring system of health. And it's completely independent of any corporate money or corporate interests. So we're here tonight to talk about COVID testing, which after all these months is really still a crisis. So we'll talk tonight about why we need COVID testing, why we need a good systematic plan for making testing accessible and available to everyone on an equitable basis, and what we as community activists can do to try to make that happen. So the US has seen more than 27 million lab-confirmed cases of COVID-19, and more than 460,000 US residents have died. It's been a horrific year, but now that we see vaccines starting to roll out, some people have been tempted to declare victory a little bit early. At the present rate, we won't have more than 50% of the adult US population vaccinated until October. And this is a table that kind of lays out the slow pace that the US has been on. This is a snapshot of a single day, January 31st, where we administered shots to only 0.4 out of 100 people. And some of you may have seen the great feature that the Washington Post published yesterday, which explained, you can kind of play with different parameters for what you assume herd immunity might be, and different stipulations about what the daily rate of vaccinations might be. And if we continue at the rate where we are now of giving about 1.5 million shots per day, if you assume that we need 70% of the population vaccinated to reach herd immunity, we won't reach that point until November 13. So the COVID-19 case rate and death rate have both improved over the last month, which we've all been really pleased to see, but many people worry that those rates are going to start to surge again in March as the UK and South African variants take hold here. So really, no matter what, for the next several months and probably into the fall, COVID-19 testing is going to remain crucial, and we can't let that product be orphaned by all the energy that people are putting into the vaccination campaign. So on his first full day in office, President Biden promulgated this executive order establishing a new pandemic testing board with a lot of new federal resources, which is all very heartening to see. But as we've all witnessed over the last year, this kind of thing really depends on strong action at the local level. And no matter what new federal resources are poured in, they can still be undermined either by governors who are ideologically opposed to public health, the kind of thing that we've seen in states like Florida, or just plain old incompetence, as we saw in New York State last spring. And so to make this promise of building effective, equitable testing a reality on the ground, we're really going to need community activism, the kind of community activism that we in the Right Care Alliance hope that we can help build. And with that, I'm going to turn the discussion over to Dr. Carleen Sabrusak, who's a microbiologist who's one of the leaders of the fabulous Nashville chapter of RCA.
Thanks, David. So I've been doing research for about 10 years as a biomedical scientist. And so I've always been interested in healthcare. And our group has actually been involved with other labs that are processing COVID tests. So it's been interesting from our group trying to understand kind of the social consequences and the logistical components of tests. So you might wonder, everything in the news, how quickly might at-home tests be available for wide and regular use? And what does that mean for us in terms of trying to understand testing? Well, it's been very heartening to hear that, Biden's bet for rapid COVID testings has gone through, and that they'll be mobilizing resources in order for tests to be more available. And hopefully these tests will actually be available within the next year. The deal with this Australian company plans to scale up 100,000 tests to US households, eventually to 19 million. And for context, 1.8 to 2 million tests per day are currently being processed. And so this gives us a lot of optimism and is really pointing us in a good direction in terms of how we'll be able to deal with the pandemic moving forward. This is not without criticism, however. Some groups point out these tests still cost $30 a pop, so kind of not reaching the point wherein people can take them multiple times a week. And for many, this might still require secondary validation via the traditional tests that we still use, where you have to go somewhere to get tested. And it's also been noted that in order for for at-home tests to really be effective, we'll need COVID testing twice at home and to be free and distributed by the government. They've also stated that, up to 193 tests are necessary in order to really open. And so that brings us to the campaign that we've been talking about. We did a survey of over 700 people, and we realized that of these 700 people, some of the clear patterns were that tests weren't always fast, reliable, equitable, or easy to access. So for example, for many, they had to wait for over 48 hours or even up to 80 hours to wait for tests. Some people waited over 3 days for results. Disturbingly, even some up to 3 months, which means that your test is basically useless. In terms of the type of tests you're able to get, saliva tests in certain areas have been deemed unreliable after the fact. Although it's important to note that rapid antigen testing does have a role if used in the right context, such as surveillance, versus whether or not someone is actually ill. Many participants paid a prohibitively high amount for these tests, some even paying over $250. Whether or not you have access to a test can be limited based off of how sick you are. And of course, people have heard horror stories about, if you don't have a car, then you basically can't get a test in many areas. And of course, many people who have jobs can't go if the testing sites are only open from 9 to 5. Equity is also distinct between different states. So as you can see, in Florida, about 1% of our survey responders had a highly difficult time accessing tests, but this could be as high as 6% in places like Massachusetts. And so this makes you wonder other aspects of whether or not it's easy to access. So some sites are so overwhelmed that people waited so long that they gave up. Some people even traveled as far as 25 to 100 miles, even though there are many different sites, such as the Stop the Spread program in Massachusetts. And many could only access tests through their primary care providers. But you don't have to believe me or these statistics. We have many different storytellers today who will now be sharing their experiences. So we'll start off with Chris, who's a healthcare organizer, and the barriers that he's faced.
Thanks, Carlene. So I had an experience with trying to get a COVID test last year. So it was last summer, and I was hoping to go on a trip, a socially distant trip to Maine. And I currently live in Cambridge, Massachusetts. So in order to go to Maine at that time, I had to get tested in order to travel. I heard I think it was a targeted Facebook ad saying that, that in Cambridge, Massachusetts, there's some pop-up clinics that were open periodically for asymptomatic people. I was very fortunate that I didn't have COVID symptoms in order to get the rapid test for travel, like I said, and as well as for people looking for new jobs and other asymptomatic reasons for a COVID test. So I biked to this local urgent care center to get tested in a nearby neighborhood in Cambridge, as well as to get my flu shot. I saw that they were offering flu shots at the same time. So I thought, well, double, 2 wins for one trip. I have type 1 diabetes, so going into a neighborhood health clinic was a risk. I've been very strict about socially distancing, especially in an area where people are gathering. I try to stay away. But I was wearing a mask, and I did take extra precautions to keep my distance to get my test. But once I got to the clinic, I had to fill out a new patient evaluation form. I've never been to that urgent clinic before, as well as input some of my personal information and insurance information, which I did feel a little uncomfortable with. But my understanding is that it was all just kind of boilerplate paperwork. But then after filling out the form, which took about 10, 15 minutes, I walked up to the front desk and asked for my COVID test. And that's only then did they tell me that because I was asymptomatic, I would have to pay $160 out of pocket for that COVID test, despite having, great, employment-based insurance with Harvard Pilgrim, as well as having a condition that put me at increased risk for COVID complications, my type 1 diabetes. So rather than going and getting the COVID test, putting myself at risk, I actually left that day because it wasn't worth $160 to go on a trip up to Maine for the weekend. So I did not get tested. Fortunately, the next day there was a change in the law so I could go to Maine without getting tested. But everyone that I visited, there was a small group of people that went on that trip. They all got tested, and I was the only one that was not able to because of this price. So that was my story with COVID. I'm happy to answer any questions. I need COVID testing to be safe, and it's currently not available.
Thanks for sharing, Chris. Yeah, it's super important that people are able to access. I mean, $160 is ridiculous. I'll now pass it on to Maite from Gainesville, who's a community member who similarly faced difficulties receiving a test.
Hi guys. So my story goes, of course I got in contact with somebody who was positive. So I immediately started quarantining. It was right before New Year's. So it was New Year's Eve and New Year's that it was completely full capacity and it was closed for New Year's. So I couldn't get a test until the 2nd. I got a test done through Walgreens, and I was told it was 2 days waiting. So the 2 days passed, and in between all this, it was my family who got tested positive. Out of all of them, my mom was the one who was not tested. She tested negative. She was a 69-year-old diabetic with asthma. So she was a very high risk. Because she was negative, we were waiting on my results to make sure that I was negative to bring it to my house. To kind of to protect her because everyone in their house was positive. 4 days later, after I take this test, I still not get any results. I decided to take it through CVS, and 2 days later, I actually got the results back. And Walgreens didn't give me results until 5 to 6 days later. In the middle of this, we kind of risked it and brought my mom to my house. Unfortunately, because I think we waited too long, and even after she got a negative test, but being involved in the household with positive, she got COVID, and she was hospitalized for 15 days in the hospital. Fortunately, she's doing okay, but I did get also COVID from my mom. I got I got a fever. So I got tested because of the fever, the symptoms. I didn't get also several days later test results about it. But the main thing is like we could have kind of saved, maybe avoid my mom being contacted or with COVID if we could get those results sooner.
Thanks for sharing, Maite. I'm really glad that your mom's okay. Yeah, waiting that long, it's basically makes the test almost useless. I'll now pass this on to Celine, who's a college student at University of Florida.
Hi, everyone. So my story started, excuse my voice, I'm a little sick. It's not COVID though. Thankfully, I just tested negative. But over the summer, I was staying in Ohio with my sister. And I ended up feeling a little sick at the beginning of July. I just felt under the weather. My sister decided to go stay with her boyfriend to avoid getting sick from me because she still had to work at the time. So I ended up going to get a test a couple of days later. And when I looked to get a test in the area I was in, there was nothing within the month that I could get a test for. So everything was at least a month away for an appointment. And obviously at that point, it wouldn't have mattered. So the closest test that I was able to get was a rapid test that was actually in Michigan. So I ended up driving an hour and a half from Ohio to Michigan, since the city I was in borders Michigan, still a pretty far drive. but ended up having to go get a rapid test there. So it was a finger prick. And also when I went, they said if you were symptomatic, it was $15. And if you were asymptomatic, it was $100. So I was already symptomatic, was $15. But so I went in, got my test. It was really quick, but it came back negative. And at this point, I couldn't taste or smell. So I knew for myself I had it. And I quarantined myself. My sister stayed with her boyfriend, so I was alone in the apartment for a week until she ended up having to come back. And then a couple days after that, I went again to the same place to get tested just to kind of confirm that I did have it. And that test did end up coming back positive. So that was another hour-and-a-half drive to Michigan once again, so I couldn't get another appointment. And then my sister ended up coming back because she had to go back to work. We tried our best, but it's a small 1-bedroom apartment, so it was kind of inevitable that she was going to end up getting it. She ended up getting some symptoms. Then we both went back to the place in Michigan. I ended up getting a positive test still, and she ended up getting a negative test, though she did have the same symptoms that I ended up having. So long story short, we ended up going back again until she was positive and I was negative. Then she went back again after that to get the final negative test. So each time we had to go an hour and a half each way to Michigan to get these tests. So, yeah.
Slim, that's insane. That's just, and most people simply cannot ever do that.
Yeah.
Thank you for sharing. I'll now pass it on to Claire, who is a physician.
Thanks for all the stories so far. I'm a primary care doctor, so I was going to talk about one of my patients. I met him and his wife when they were trying to get pregnant, and he owns a corner convenience store in Dorchester, Massachusetts, and he runs it with just one employee, and he has no other source of income, so he really couldn't close it even during the height of the pandemic. And he was being incredibly careful. He was practicing all the public health guidelines, but this was one of the hardest hit neighborhoods in the Boston area, and he still ended up catching COVID. And he really wasn't symptomatic at the beginning. And by the time he realized he was feeling sick, he did isolate himself, but he already had passed it to his whole family. And he lives with his wife, who was pregnant by then, his brother, and all of their parents, so 4 elderly parents. Luckily, they all recovered, but one of the things the RCA has been debating a lot about is the role of testing essential workers who are asymptomatic. And his story makes me wonder that if that had been available to him, whether he would have used it, whether he would have known sooner that he had caught the virus. He still would have needed to quarantine somewhere, so it wouldn't have totally solved the problem, but it potentially could have helped. And when we talk about this idea, some people worried that, essential workers might not want to be tested. The phrase surveillance testing sounds really scary and intrusive. But if you look at the people who have the means, a lot of them do want to be tested routinely. For instance, my neighbor works at a lab at Harvard, and he almost never contacts people, and he's getting tested once a week. And it really shouldn't be just the people with the means who have that as an option. My patient was really worried about catching COVID and how it would affect his family, and it would have been nice as his doctor to be able to offer him that option.
Thanks for sharing, Claire. Yeah, it's just multi-generational homes and just the broad impacts that we often underestimate. Now I'll pass on to Meghna, who's also a healthcare worker.
Hi, my name is Meghna. I'm a dentist here in Nashville. So someone that's routinely exposed to COVID almost daily because the spread is pretty much uncontrolled here with our very lax rules. So I had a lot of difficulty getting tested whenever I felt like I needed to get tested. We have a lot of Nashville did set up some testing sites, but they're only open during working hours. If I take off work, we shut down the clinic. No, there's impacts beyond me for me getting tested. And then, or if the weather is cold outside, we shut it down. So luckily I had the privilege to get tests where they're convenient to me, but in the end, I ended up I've paid over $600 in testing, I think, because, and thankfully I have the means to do so, but you know, how else, there's no other way that someone else not in my position would be able to do as much as I have. In the end, I did end up getting COVID from my partner from his office when one of his coworkers met up with someone from out of state who worked in a nursing home. She gave him COVID. He went home. He had to come back to the office to get his computer and stuff because he was waiting for his test results. He came back on like day 3, but he still didn't know if he was positive or negative. So he came into the office to grab his computer and then consequently infected, even though they're all wearing masks, infected the entire office of like 15 people. And so even though we don't, like I don't go to restaurants, I don't go to the grocery store, my only exposure is from the office, we still end up getting COVID. And thankfully that spread stopped with us, at least with our, you know, little tree, but I don't know how far those other branches have gone with that one person's decision. So again, like, even though I've spent so much money to make sure I didn't get it, it still ended up happening because it's just uncontrolled right now, unfortunately. Yeah.
That's crazy. And you've been tested like 15 times, right?
Yeah, because, and even though I'm a dentist, we have the Tennessee Dental Association, we do have an organization that helps us for a lot of things. There's no way for essential workers like grocery store workers or, you know, people that are on the forefront to get testing if you're not part of a large hospital organization or a university. There's just no way, you have to do it on your own.
Right. Yeah, you can't even imagine all the different situations. But yeah, thank you all for sharing. And I think this really kind of compels everyone to consider that it's people like us. Unless someone like you cares a whole awful lot, nothing is going to get better. It's not. So today we're not just going to talk about all of the different problems involved in testing. We're also going to talk about strategies for addressing these institutional problems. So today we'll talk about how to pursue publishing, policy, and establish protests. And so moving forward, it'll be important to think about how do we take action using these 3 Ps. So think about what we've talked about so far for barrier-free. So FREE, to pursue fast, reliable, equitable, and easy to access testing. Of the B-free, what resonates most in your community? What is the most difficult area of access for people that you know? How do you personally relate to B-free? And what ideas do you have for facilitating and helping your community? So soon we'll be going into breakout groups that will be led by Shannon, Jason, Sharon, Ricky, Francisco, Deidre, and Elizabeth, who have all volunteered to be facilitators for all of these different groups. And so what will we be doing? The published group will be talking about how to learn to write an op-ed and get it published. The policy group will be figuring out who makes policy decisions in your community and how to influence them. And the protest group will discuss planning a rally or demonstration, calling on your policymakers for expanded testing. So if you can, please type in the chat whether or not you would like to be in the publish, the policy, or the protest group. And we'll get you sorted. I
love that power when I can just pull people back here. So welcome back. I hope you all had good discussions. I was popping in and out a little bit.
Okay, Chopper.
So we're gonna talk we have less than, it's more like 5 minutes. It's gonna be really quick. Time has flown by. But one thing I wanna say before we hear back from people in every group to hear what they talked about is something that I heard in many groups was, well, how do we figure out, we're writing an op-ed, we're planning a protest, we're writing policy, but what specifically are we working on for that? And so the RCA's Be Free, Barrier-Free Testing Campaign. Carlene, do you mind putting the slide back up that goes over what each element of that is for? So each part of Be Free stands for a different element of a testing program that we want. Truthfully, we need the vaccine program to have that as well. And the idea is that our tests need to be fast They need to be reliable. They need to be equitable and easy to access. And all of our RCA chapters have been talking about which of these 4 components do we have and do we not have in our communities. And so any chapter leaders you work with will be able to tell you what your chapter has decided to pursue in your community. If you don't live in a chapter location, and I'll go over those locations in just 1 second, please come talk to us. We're going to be having more calls coming up in the next few weeks to talk with everybody about how do we figure out which of these do we have in our communities, which do we not, or maybe it's really an equitability issue. Some people have access to all of these and some people do not. And so if you don't really know where to dive into that yet, don't stress about it too much. We'll all be working on that together in the coming days and weeks. And so our chapter locations are Boston, Nashville, Washington, D.C., and Gainesville, Florida. And if you don't live in one of those places, come talk to us. All right, so from that, let's jump into this conversation. We have basically about 1 minute per report out group. So I'd like to ask somebody each from Publish, Policy, and Protest to report out. Let us know what you talked about and what your next steps are. So who can report out from Publish?
So we forgot to assign somebody for that task. So you know what? I'm going to ask somebody to do it. Leilani Dodi, would you mind being the person that just sort of very briefly says what we talked about?
Well, we talked about how to identify a single point and grab a reader for an op-ed in maybe 700 words, 700 to 900 words. If it's a letter to the editor, maybe in 200 words. And those structures will be defined by the newspaper. And we said, start off with some kind of a reader grabber, make sure some kind of a timely topic, and start introducing what your recommendation is. And then introduce what arguments may be out there. And this is for the op-ed piece. And say, you know, some people are thinking this, but, and then you put what your recommendation is. And then, so as you argue the case, and then you end it with a kicker or a point of humor or some kind of a zinger that leaves your recommendation with the reader and encourages them to share the article with someone else.
Thank you. Awesome.
Thanks for that. All right, now let's go to policy. Who can report out from the policy group?
So I got elected to report out from policy. I've not been to one of these meetings before, so excited. One of the things we initially, Sharon and I'm sorry, I forget the other person that was the moderator. Ricky, hi Ricky. We went around and just kind of talked about different actionable items that we've been trying to do in our community. And one of the things, I'm a student and an employee at Georgetown University, and some staff and students and I got together and we were, you know, just concerned about the COVID policies. Like there's been some write-ups in the Washington Post and different things. We wanted to know how the CARES Act money was being spent, and just kind of one of the I guess kind of logistical things that's hard with that is like, do we need a FOIA? Like, how do we find out this information? Is it publicly available? So Sharon suggested one, you know, reaching out to maybe a reporter who has done, you know, reporting on other CARES Act spending at other colleges and saying like, hey, how'd you do that? And two, just following, you know, different breadcrumbs and seeing where it leads in your advocacy.
Awesome. Thanks for that, Mary. And now let's hear from Protest. Who can report out from the Protest group?
Didn't actually designate somebody to read out. I'll briefly give it. Our protest group actually had a lot of old timers. We had Alan and Aaron Teleos, our communications guy from Lown, and some newcomers who were interested. So we briefly outlined the four most important parts of how to plan a protest. And we talked more also about the nuts and bolts of how can a local protest in your local community lead to a statewide or nationwide campaign, or be part of a nationwide campaign, or something that maybe even spreads worldwide. We talked about the rite of passage that many organizers have gone through, the Marshall Gans course. Briefly, Aaron talked about the simple nuts and bolts of having a target in your community to protest about, as well as the importance of listening to your community to find out what people are incensed and outraged about in your community, that we need stories and narratives, good narrative, and that you need a target of your protest. We also talked about the importance of cultivating good relationships with media people, TV, radio, journalists, finding a reporter in your area who's interested in the cause that you're interested in, can become a mouthpiece and amplifier for your story. And we also shared that we will have a follow-up Zoom session on February 20th at 2 p.m. for anyone who wants to find out more about how to mount a protest and how to get people involved in doing a protest, or wants to follow up on the meeting itself. February 20th, 2 p.m. We'll be doing that, and we'll be sending out a notice about that.
Awesome. Thanks, Francisco and Elizabeth,
You're welcome.
for putting that into chat. That was exactly what I was going to say about next steps. In just a couple minutes, we're going to hear and see some slides with more specifics of the next state. Each breakout group is going to have a follow-up meeting. So if you were in policy, but actually what Francisco said was exciting, you want to help plan a protest, you'll be able to join for that call. So with that, our time is coming close to an end, and I'm going to turn it over to Shannon, Carlene, and Ricky to close us out.
Whoops, technical
Steph.
difficulties.
Oh dear, oh dear.
She's putting her kitty filter on.
Has everybody seen that? That is so funny. Oh my goodness.
Yeah, so I'll just want to introduce Sharon, who's one of our co-founders. Can you all see my slide?
Yes, yes.
Okay,
So
cool.
I'm Shannon Brownlee. I'm a co-founder of the Right Care Alliance, and I am senior vice president at the Lown Institute. And you know, I got into this work. Vikas and I got into this because I got into it because I had been a writer for many years and written a lot about medicine and shortcomings and conflict of interest and all kinds of scandals. And I felt like it wasn't making that big a difference. And I thought, you know, it's going to take a lot more than just pointing out the problems. It's going to take power. And in meeting Vikas, it was an opportunity to recognize the power of movement building. And that's what really has driven me to get involved in this kind of work in organizing. And I think it is incredibly powerful and incredibly important. So there are a number of things that you can do if you want to be actively involved in the Right Care Alliance and in the movement for a better system, a better health system. One of them is sign our petition. There's the URL, and I think the slides are going to be available. Two, really important, talk to other people. Talk to them about how to plan a protest in your town, and be involved. On Saturday, February 20th, you could come talk to a group of RCA folks. Learn more about how to change the policies around testing in your own city, in your own town. For example, the city council is very powerful in Washington, D.C. and has a lot of control over what happens. And then in other towns, the state may have more control. And then join us to write and get feedback on an op-ed. We're going to have kind of a write-a-thon on Sunday, February 28th.
Awesome. Thank you, Shannon. And kind of to tie things up, Ricky, who is from one of our other groups, will now share a little bit about his experience. I'll let you, take it away, Ricky.
So hey everyone, I'm Ricky. I'm a third-year medical student at the University of Florida in the MD-PhD program. And I thought to help tie this all together, I would show this picture. Some of you may be familiar with this. This kind of became popular on the internet around November. And the story behind it, I think, is really deep. And I think it's really important to remind everyone why this is important. it reminds me why I'm in medicine essentially, and why I find this so important. So this man who's shown here was a patient in the hospital, and for those who don't know, being in a hospital while having COVID is an extremely isolating and extremely stressful situation, as I'm sure everyone here can imagine. So these patients can barely talk sometimes because of how bad this virus attacks their lungs. They're in and out of ventilation sometimes. In the more extreme cases, delirium is very serious. And this guy was just brought to the point of such emotional distress that he broke down and cried. And he just said, I just want to see my family. I just want to see my wife. And having probably only interacted with people through masks for days at a time, he just couldn't hold it in anymore. And the doctor was so overwhelmed that he, in his full PPE, as you can see, just embraced him essentially. And the reporter who was there was a photojournalist who was just so moved by this. He just thought it had to be reported. People had to see this. And the reality is, this virus is affecting now, it's taken now 500,000 lives in America. So cases like this are happening every single day. And I think that right now is a very unique time in history, mostly because we are becoming aware of these issues, these cracks in our healthcare system, which have been there for years, which we have been trying to talk about for years and been trying to solve for years and haven't gotten solved. But now, not only do we have a political difference, but we have a community difference. People are able to fight through apathy now. People are able to see through it. And I think that we can't waste this, because this is an important inflection point in history where it could go either direction. And I'd like to believe that we can go and learn from this and make the best of all the terrible things that have happened. And the reality is we can't do this alone, because doctors have been trying to do it alone for a while. It hasn't worked. And we need all of your talents and your abilities as well. And that's why I think this organization is extremely important, and why I think if you guys liked this, you should stick around, because there are a lot of, let's be honest, there's a lot of more fun things you guys could be doing right now, but instead you guys all chose to come to a town hall meeting on COVID. So I appreciate your time, and I encourage you all to make the most of it. And thank you for your time.
Thanks, Ricky. I think your perspective is so important, especially, being part of the group of people who are trying to make things better. I think, everyone here is just trying to find some way to make things better. So I really appreciate you and everyone taking the time. So yeah, with that, I'd like to thank everyone who came. I'd like to thank everyone on the planning committee who helped make this happen and make it so that we could have over 50 people who attended tonight, which is awesome. A lot of that is also up to Natalia and Celine, who are part of the communications team. Really appreciate everyone's work. And kind of to close things off in the mindset that we're in, Claire suggested that we have this song by Yo-Yo Ma that he wrote, kind of commemorating everything that's gone on, called The Memorial for Us. And I also wanted to share a poem about this experience. We have a virus of uncertainty and fear. We have a virus of shortages and gun sales. We have a virus of jobs lost and rent unpaid. We have a virus of talking heads and false knowledge. I have a virus of canceled evenings and canceled days. Calendar emptied, free from the inertia of saying yes. Destination home, thoughts wander. Choices removed, freedom gained. We kill the virus with questions. We kill the virus with challenged truths. We kill the virus with kindness. We kill the virus with patience. But yeah, thanks everyone for coming. And I really hope that you learned something, or at least enjoyed connecting with other people who have the same type of heart and mission as you do.